All right, welcome everybody to the Health Transformation webinar. This is your co-host Cade Archibald, and really stoked to be here with you guys today. And we got a really exciting topic that we're going to be diving into. With me, as per the usual, but not to be taken normal, is Regan Archibald. Regan, how you doing?
Good.
Awesome. Well, so today we're talking about exosomes and some of the impacts they can have on stem cell treatments and some things there. And so I'm really excited to dive into this.
Yay.
Yeah. So any of you out there, whether you're on Instagram or on the webinar, feel free to type anything into the chat box, especially on the webinar. I'll be moderating that. I am not always able to comment on the Instagram feed, but I will try as well. But let's kick this thing off.
Okay. So exosomes are, speaking of weird, thank you, Steve, and normal. Exosomes are, it's almost like, you remember Star Wars when you have like the intergalactic, what do you remember? You're not a Star Wars dude, Cade, but neither am I, which is the problem. But you know how you have the big ship and then you have those small ships that deploy from it? Well,
yeah, you got the Death Star.
The Death Star, is the Death Star the big ship?
Yep. And then the TIE fighters.
Okay, so you got the Death Star and the TIE fighters, and what a stem cell is like the Death Star. So it's like a big cell and it's undifferentiated and it's just sending out signals and communicating with your body so your body can heal. And exosomes are the communication signal that leaves the stem cell. And so what we're going to be talking about today is this critical piece of stem cell recruitment and stem cell healing. And these little things are called exosomes. So they're extracellular vesicles. And these extracellular vesicles are a way that we've been utilizing treatments to enhance stem cells, to enhance growth, to enhance the overall regenerative factors in stem cells. Not only stem cells in your body, but stem cells that we're placing into joints, into brain, into your heart, whatever area we're trying to enhance. Exosomes have proven to be very powerful. And so if you guys just kind of look at a knee here, so we'll start with knees, and then what we're going to do today is I'll spend about 10 minutes talking about knees and how to clean up the environment, how to really get your body out of pain, and then we'll transition and we'll talk more about kidneys. Some of our patients have had kidney failure. We'll talk about brains, using exosomes to treat the brain. We'll also talk about using exosomes for stroke. Which is very interesting. So if you guys have any questions, any particular thing you'd like me to cover today, feel free to type it in and we will make sure that we handle that for you. So first of all, if you take a knee, a lot of people come to us because they don't want surgery, or there's three types. One is someone who has a knee that's just starting to deteriorate. They know something's wrong. They just can't quite, they don't quite get the length and the distance that they used to out of their knees. They get more sore after 6-7 miles of hiking. That's unusual. We also have the other type of patients who've had knee injuries. They have osteoarthritis in their knee. Their meniscus is torn. They have ACL injuries. And these are people who don't want the surgery. And then we have patients who've had the surgery and their knees still aren't doing better, or they had the surgery years ago and they don't want to put their body under that kind of stress again. Because when you get surgery, anytime you cut your body, what happens is it changes the internal structure. So one little scar on your body, I want you guys to look at your bodies right now and look where do you have scars? Because that scar is not just on the surface of your skin, it goes much deeper. And so that's where the regenerative medicine is really powerful. And so one of the things we'll do is we'll take stem cells from umbilical cords and we'll inject it into the damaged knee. And we have great success with that. But then one of the other factors that we can couple with the stem cells is, well, we use PRP, we use ozone, we use acupuncture. All those are proven ways of promoting stem cell growth. But now what the new science is showing in the last 2 years, it's been an explosion in the regenerative medicine world, and that's called exosomes. And so you guys, yes, you are on the cutting edge of science listening into this today. But exosomes, like I mentioned, they're these little extracellular vesicles, and they can travel and go deeper and penetrate deep into the tissue, into your bone structures, into the organs, and they dock on what are called progenitor cells. So they find these cells that are stem cell-like, and they activate the stem cells in your body. So this is where we take stem cells, and then we amplify it by a magnitude of 10 or 100 by putting in exosomes. And usually we'll put in about 3 billion exosomes into an area that's been damaged. We can do it IV, we can do it intranasal, we can do it through an injection. So very powerful treatment with the exosomes. And so if you look at what an exosome does, the very first thing is it increases stem cell migration. So think about areas of your body that have been damaged, and maybe you don't even know which areas of your body have been damaged. But if you think about those areas that have been damaged, hey, Mom, welcome. If you think about those areas that have been damaged, the very first thing you want to make sure that happens is that stem cells migrate into the areas that have been damaged. Without migration, Cade, what's going to happen to the regenerative properties?
Without migration, there's just not going to be really any way that those regenerative properties can get to the specific area.
Right. And so that's where stem cells, whenever we use StemVive, they do have their own exosomes in there. But when you amplify the exosomes, it's like you're amplifying migration. The second thing you're amplifying is proliferation. Proliferation, what that means is that's when stem cells start multiplying and they double in number. And so if you can increase stem cell proliferation, what that does is it gives you more structure. It gives you more healing capability. It also increases the matrix synthesis. And so anytime you are restructuring or remodeling a joint, you got to have the substrates in the right place. So what a matrix synthesis is that's like the scaffolding that exists in your body so that you can start rebuilding cartilage. It's also the scaffolding that you need to build new tissue structures, like in the brain or in the kidneys or in the heart. And then it increases anti-apoptosis. So there is a marker in your body that actually increases cell death. These are called tumor necrosis factor alpha and IL-6. But what happens is exosomes turn off those markers so that you get more cellular regeneration. Cells come to life. And then you have a modulation of immune reactivity. So if you have a joint here like a knee, and that knee is not healing, one of the things that you can do is we can put exosomes into that knee, and that will modulate the immune activity, which means it turns off arthritis even stronger. And so what we have found is that now using StemII, and that's the stem cell product we use from Utah Cord Bank, coupling that with exosomes, maybe a month to 3 months later, that can be a great way to give your knee a nice little jolt into action and activate all the stem cells in that area. And so very fascinating. So typically we'll use it for signaling improvements. In some cases, we'll do it 7 to 28 days. We have patients who have been flying in from Canada because regenerative medicine in Canada is, unfortunately, it's still illegal. They can't do any of this stuff in Canada. And so they come down here, and sometimes we'll do exosomes same time as stem cells, and that's just fine. It can be delivered through a smaller needle. Like I mentioned, we'll typically do 3 billion exosomes depending on what the condition is. And so let's talk about some of the properties of the exosomes. First of all, exosomes will stimulate VEGF. So these are blood formation, the formation of blood vessels. And Cade, what happens to your body when you have good circulation and good blood vessel health?
You'll typically have really high functioning body if you have good circulation and good blood flow.
Yep. And do you remember the protein that exists in the perinatal tissue that increases the formation of blood vessels?
Yeah, it is. IL-6 is what it drops. It's I can't
do. Not to put you on the spot, but think Timpanogas.
Yeah.
Everyone in Utah, you guys know Mount Timpanogos, and I know we have people from all over the country, all over the world here, but Timp2 is the mountain in Utah. Beautiful, my favorite mountain range, arguably in the world, next to the Tetons. But Timp2 is a protein that's found in the perinatal tissue, in the actual blood of the perinatal tissue, and that TIM2 helps regulate blood vessels. So now you're just doubling the amount of circulation. So a lot of us, when we get old, we get a condition called sarcopenia. And if you think about what sarcopenia is, that's where your blood vessels get brittle, you lose circulation, and then your muscles atrophy. Now, I don't know if anyone on here is old, besides Cade, but as, but one of the ways of negating aging is getting rid of sarcopenia. And so VEGF is one of those molecules that is increased when you have the exosomes. The other molecule, ICAM1, it binds to inflammatory ligands on white cells. So once again, it helps calm down the inflammation in the area much quicker. IL-1, RA, it binds and sequesters the inflammatory cytokines. IL-1, that's IL-1B specifically for you nerds out there. And IL-6, which is responsible for macrophage activation, which can put you in an arthritic response. So it binds to those and calms down that inflammatory process. It also works on IL-10, which is an anti-inflammatory cytokine responsible for immune modulation and regulatory T cell conversion. So interleukin 10 is really important. That's the interleukin that gets secreted when your body's been exercising. So if you read the book Younger Next Year, they talk a lot about this molecule. And Mom, I know you've read that book. I think I gave it to you as a gift. And so you can read all about that in Younger Next Year, is IL-10. Exosomes, what they also do is they promote capillarization through VGIF, pro-angiogenic microRNA structures. And so if you think about what is a microRNA, Regan, and why are we going through this complete biochemistry conversation? Well, I think it's really important that you guys understand the mechanisms behind it, because one of the things that you can do is, if you understand what some of the properties are, then you can actually visualize how your body can heal, and you can influence it to heal even more. And so you put exosomes in there, and first of all, the VEGF, that's going to increase your vascularity, so you're going to feel better, you have better circulation. You'll go on your walks and you'll say, man, my knees warm up much quicker. You guys know how it is on a cold morning when you get out of bed and everything's like, oh, it takes you 5 minutes. You're like the Tin Man in the morning. Well, that's because you don't have enough vascularization. You don't have good blood circulation. So you want to be able to jump out of bed and feel great. I mean, if you had to, you'd go and run a mile, and I'm not saying sprint out of bed, that you got to get the muscles warmed up, but being stiff in the morning is a classic symptom of not having good blood vessels. And good circulation will heal your body. It will keep you young. And then the microRNA structures, what they do is they carry a message into the cells. So cells that are not responsive or cells that are unhealthy, the RNA, the microRNA go in there, and it's like rebooting a cell. It's the same thing that you do to your phone when you download a new app. That's what happens to our cells when these microRNA structures from exosomes come into the cells. It's like rebooting the cells, so the cells can help the stem cells in the healing process. What else happens is it increases muscle metabolism. It enables the delivery of glucose and insulin intracellularly, and thereby it lowers hemoglobin A1C. So exosomes have been proven to get rid of insulin resistance or type 2 diabetes. It can help facilitate in the reversal of that. Of course, along with lifestyle changes, diet, but this is one of the most powerful things that we've been seeing with diabetes. So very interesting. Here's an image of a stem cell. So this is, oh, go ahead, Cade.
Hey, Regan, I think the PowerPoint on the webinar is not moving forward.
Okay.
We're still on why exosomes post stem cell treatment.
Oh, okay. Well, let me stop share.
You're in you're not in the presenter view or something like that. Anyway, thought I would just.
Okay, can you see it now?
Yeah.
You
Yeah.
got that? Now, is that better?
Yeah, but it's crazy. We're one slide behind you because I'm watching you on Instagram as well.
Weird. Okay.
That's wild. All right.
Um,
Anyways, but we can keep up.
okay. Sorry, guys. Um, I do not know how to fix that. I can go end show and I can try a different screen. So fix this real quick.
Yeah, see, we're on that slide right now. The blood. Now we're not.
We're off.
Yeah, so I think whichever one you're scrolling through that's on your right hand. Yeah, so stop for just a sec. Yeah, so we're on the same one now.
Okay.
Where we got one exosomes travel deeper into renal tissue, and then 2 exosomes use signaling from either progenitor cells, parasites, MSCs.
Okay. There we go. Okay, so let's look at kidney disease and let's talk about why we want to use exosomes versus stem cells. But what we found is you've got to use them together, because imagine if you just put the soldiers, the troops to battle, but you didn't have a general. You know, the troops are going to be good for a minute, but then they're going to get completely scattered and they're not going to know what to execute on that's a priority. And so the big thing when you're looking at this, the big thing you want to do is when we put stem cells into the body and then we infuse it with exosomes, the exosomes, do they improve the signaling of the stem cells? But they can travel deeper into the tissue. So in a condition like renal failure, and by the way, we have so much evidence on renal failure. I was looking at the literature. We're doing our presentation this weekend. We've got a bunch of doctors coming in town and clinics. And so I get to do all the research and then share the knowledge, and then we put it into clinical application. But if you look at the amount of research that's been done on kidney failure with exosomes, it's phenomenal. And they found that just stem cells alone is helpful. And we've helped our patients improve kidney function dramatically. We had one of our patients this week who I met with, and she's not on dialysis. Her kidneys are improving. We treated her a year ago. But now what we're seeing is exosomes can just take it to the next level. And so exosomes, they do travel deeper into the tissue, because if you think about how small these extracellular vesicles are, I mean, they are like 30 to 150 nanomoles. I mean, they're tiny little particles, nanoparticles. And if you look at a stem cell, even though, you know, cells are tiny, but a stem cell is like massive compared to an exosome. So here's a study that was done in 2016. They took 40 patients with stage 3 and stage 4 chronic kidney disease, and they were randomized into 2 groups. And by the way, you can go to www.exosome-rna.com/questions=kidney. That's the website you can go to reference a bunch of studies, and this is just one of them. One group was given intravenous and intraarterial exosomes, while the second group served as a control. What they found is that renal functions improved significantly in the treatment group, as seen by increases in GFR. So GFR is one of the major markers that we look at, because it shows all 3 compartments of your kidneys. Now, GFR, what they found is that the increases in GFR, that's a good thing. And then decreases in the serum creatinine, and that's a good thing. And BUN and anti-inflammatory markers, TGF-beta and IL-10, and the pro-inflammatory TNF alpha. So what they found is, wow, this is incredible, because they're actually promoting regeneration. The anti-inflammatory TGF-beta 1 and IL-10 peaked at 12 weeks and then persisted above baseline throughout the 52-week follow-up, while TNF alpha showed a through level at 12 weeks and persisted below baseline at 52 weeks. So remember, the IL-10 is, you want that to be higher, because that's your pro-growth molecule. That's your youthful molecule and younger next year. And so that stayed high, but your anti-inflammatory, the aging molecule, tumor necrosis alpha, actually stayed low for a year. 52 weeks is how long they did this. And there was no negative side effects from that. Okay, so let's talk about the brain. So pretty interesting, right, Cade? I mean, kidney failure, typical.
Yeah, that's fascinating. Amazing stuff.
Yeah, typical treatment is you get on dialysis, and you're on dialysis for the rest of your life. I mean, you're just stuck on dialysis. And that is a very debilitating place to be. So anyone you know who's got diabetes or who has kidney issues, you need to let them know that there is treatment available that goes way beyond what we've been taught about. Just get the prescription and you're on your way. So strokes. Now, stroke is something we've had great success with using stem cells. And what we're seeing now is that we can use exosomes, and the exosomes actually can drive even deeper into the brain tissue. So if you're thinking about rejuvenating your brain, or maybe you've already done stem cells for your brain and you're like, nah, I want to take it to the next level. Well, if you've had your stem cells within the last year, we can do exosomes with you without adding in more stem cells. And the exosomes will go in there and activate the stem cells that have already been placed in your brain, which is actually pretty darn cool. Here's a study done at the University of Georgia. And what they found is the exosomes, which are red, that were infused into a patient who had a stroke. What they found is the areas taken up by the nuclei, the blue neurons, and the green in the brain of the stroke victims. So you can see that these exosomes are going right into the brain cells and being taken up. And what they found is that these mice who they induced strokes on, they had improved motor recovery, improved memory, and they compared the MRI scans of the mice who'd been treated with the exosomes versus the mice who hadn't. And they found that the treatment shrunk the size of the injury by about 35%. So to shrink the size of an injury in the brain by 35%, that is almost half the amount of the brain tissue that was lost as a result of a stroke, which means a lot of these mice had no symptoms after they treated them. So phenomenal. So you do another treatment and it basically eradicates all of the damage done by the stroke. The exosomes, they don't demonstrate first pass effect into the lungs. So when you do it intravenously, the exosomes are going to be able to get through the lungs very easily. They can cross the blood-brain barrier without utilizing mannitol. So we don't have to put your kidneys under stress by using that drug mannitol to open up the blood-brain barrier. MSCs, sometimes the stem cells, especially if you're using like a bone marrow transplant, the MSCs can be perceived as foreign, whereas the exosomes are very safe for your immune system because, once again, they're just going in and they're finding your own stem cells or the stem cells that have already been implanted, and they're using the intelligence of your body to go and regenerate areas that have been damaged. So they're able to evade the immune response. You're not going to see any type of immune resistance from that. So that is, exosomes are a fascinating thing in medicine. We recently treated one of our patients who's had ALS, and he's arguably got more stem cells than anyone else in the world. I think he's at about 3 billion. And he came in and got exosomes, and we doubled his number. He's on my last podcast on Go Wellness Radio. Just a phenomenal man, and Warren talks about it. And I was just emailing him yesterday, and he said, yep, he's very excited about what he's experienced as just a nice little boost to the stem cells that he's received from the exosomes. So I think this medicine is incredible. It's very exciting. I think it's something that, if you look at how much do you value your health, how do you want to feel during the holidays? Do you want to feel excited? Do you want to be your best self for your family, your friends, the people who you'll be spending extra time with at the end of the year? I'd encourage you guys to get your body taken care of. I mean, it is the season. We're almost to the end of 29, and right now is the absolute best time to start taking care of your kidneys, your liver, your heart, everything. There's also studies that will show, maybe next week we can go through some of the cardiovascular studies that have been done with stem cells and exosomes. But get in there and come work with us. These things are complex and not for everybody, but as we sit down and we discuss your goals, I think you'll find that there's some phenomenal pathways we can take you down. So, okay, Cade, any questions before we finish up?
No, I've handled most of them just through the comment box. But yeah, awesome stuff. I think there was a question around, we talked about peptides and some things for improving brain health last week.
Yeah.
And so, yeah, there's just a few questions around, is this something you can do in conjunction with exosomes?
Every time, yeah. Peptides, exosome, stem cells. If you want the stack that's going to get you the most mileage and really rebuild your brain, that's the way to do it. So we would do this, the StemVive intranasal, exosomes intranasal, and then we'd get you on like cerebral lysin, CMAX, or we'd get you on RG3 synapsin.
Beautiful.
Yeah, great question. Yeah, that is my ideal way to treat the brain. Powerful.
Amazing. Well, thank you so much, Regan. Amazing content today. Hopefully you guys feel like you learned a lot, got a lot of things that can help improve brain function. So we'll be back same time, same place next week. And love you guys very much. We'll see y'all.
Bye-bye.